Hi, and thanks for tuning in. This is just a quick tutorial in response to some questions I've been getting about what should a pharmacy be putting out on social media, how they should be marketing themselves, or if they should be posting anything on social media, and also how can pharmacies battle the reduced footfall in the pharmacies and reduced impact of um, weaker OTC sales by increasing online sales. So what actions could you do to increase your online sales? So I'll quickly run through that. Just so you know, to give you some background, if you don't know me, my name's Colin Baker. I'm a registered pharmacist in Ireland, but I'm also a digital marketer, and we have a award-winning digital marketing company, Full Blast Advertising, and have recently started a pharmacy-specific digital brand called thesocialpharmacist.com to help pharmacies with their digital marketing. So take this advice as coming from a pharmacist who knows the ethics and responsibilities that a pharmacist must have at this time and in general, but also someone who also knows a bit about marketing too. And just so you know, if you need any help getting this right, just message me there, send me an email, column at socialpharmacist.com, or visit the website. If anyone wants to get their message out properly on social media about this, get real proper information managed, reach all your following about your updates and that kind of thing, reach out to me and I'll be able to help you free of charge for the next couple of weeks. And I don't know how many people I'd be able to help, but just reach out and we'll do our bit together to get it done for you free of charge. But in this tutorial, I'm going to share how to get your key messages out to all of your followers and your local community, even if you aren't on social media at the moment. If you don't even have a Facebook page, how you can go about doing that. But also, if you do have a Facebook page and you don't use it, or just in general, if you are very active on social media, only a certain proportion of people will actually see your message. So not all your followers are going to see your message. Not all your customers follow you on Facebook. So how can you get that message out to everyone? Maybe about that you're now offering deliveries, maybe that you have different practices of people entering the pharmacy, social distancing, different opening hours, things like that, or that people can now order online. If you want to get that message out there, I'll show you how to do that with a couple of quick hacks. Then I'll also talk about some actions you can take to increase your online sales if you have an e-commerce website. And I'm basically just going to run through the actions you can take. There's lots you can do, and to do this is a huge task. To do it comprehensively and to do it profitably. And that's what we do for companies. But if you want to make a quick start on this to get your kind of local customers, your followers, people who already know you, will show you that. And then finally, we're going to talk about the responsibility of being a healthcare expert and the impact you can make on public health through your social media channels. And what I mean by that is that you should have been positioning yourself as a healthcare expert anyways before this, and providing knowledge, providing advice about healthcare, about medication, about diseases, about conditions, about management, that kind of thing. But if you haven't been, you should definitely be seen now as someone who is providing reputable advice on things to do to reduce the impact of coronavirus on health. And I suppose most people who aren't used to marketing or aren't used to using social media don't realize that you actually do have an influence, and that people trust pharmacists and understand that you're a reputable source of information. So use this to help reduce the spread of this public health crisis, but also you will have some other positive effects in the background, that you will get a huge amount of goodwill from your local community, and you'll also be positioning yourself well compared to your competitors. So before we start, I would just say to everyone, review all the content and any ads that you have running in the light of the coronavirus pandemic. And this is online, offline, or wherever you might have stuff running. think about, have you scheduled posts on Facebook, Instagram, LinkedIn, Twitter? Are they still relevant now? Should they really be going out? Could they offend people? Could they look wrong? Could it be perceived as the wrong message be putting out at the moment? Do you have ads scheduled to run in the next while on social media channels, on radio and newspapers, on with other local partners, on TV, anything? Just check that, review it thoroughly, and make sure it's still relevant. I would say the most important thing is this is a huge opportunity, but also your responsibility to influence public health. And through your social media marketing, you have a following, you have a position of influence, a position of trust, a position of expertise, and you should use that. And yes, there may not be a huge financial benefit to you, but at times like this, you can really hit home why pharmacists are so valued in the community, why there should be a greater role for pharmacists in community health, and above all, just general being a nice person and helping out. So I would say that nothing has changed, but everything has changed. You should have been promoting stuff about different healthcare symptoms, about different conditions, about how people can treat them, about how people can manage them, about how people can provide advice on different products, medication, symptoms. You should have been doing that, but if you weren't, now is the time to do it and to start with the coronavirus. You have a major part to play, not just as a healthcare provider, but also as a responsibility as a healthcare promoter. So the first thing we are obviously doing as pharmacists is getting people their medication, putting their fears to rest when they ring in, when they reach us about their symptoms, giving them advice on what they can do to minimize the spread. And pharmacists are, at the front line and really doing a great role there. But then secondary, you can also become a healthcare promoter through your social media channels, through your marketing, because you have influence and trust. So I would say we're all in this together, and we can definitely do more and make a bigger impact to reduce the burden on our healthcare system and our communities. And if you can help one person, why not do it? You can make a difference to public health by sharing reliable information that will educate and thereby influence your community's actions. As we have seen, there is constant misinformation and incorrect information. Your pharmacy is in a position of trust and influence, so you need to start using social media to spread not only updates about the changes to your pharmacy practice, that might be how many people are allowed to enter the pharmacy at a time, stuff like not signing prescriptions, maybe social distancing, maybe free deliveries, but also responsible guidelines for public health. So be that voice in your community that's championing the public health issue. And, don't think that, everyone's doing it. I'm not really adding any value, or, there's other people to do that. Like, if we look at huge studies from e-commerce companies where we can track everything, we find that repetition is key, and the number of times a message is viewed and engaged with on multiple platforms leads to increased action. So e-commerce studies would show that the average purchase happens after 3 interactions, and the highest value purchases happen after 7 interactions with a brand on multiple platforms. So definitely keep a consistent approach to your marketing, keep pushing out that content, and don't be worried about repeating the same message, I would say. And just some really quick approximations, just to really emphasize that you do actually have an influence here, and that if pharmacy as a whole took action on their social media, that you can get a message across, you can reach loads of people, and you can influence a good deal of people. And I would just say that before these approximations, this webinar was thrown together in double quick time, as you can see from the wonderful design So they're not the most mathematically sound calculations. But according to the PSI website, there are 1,955 pharmacies, 6,479 pharmacists, and 289 pharmacy assistants registered in Ireland. So, you have close to 10,000 people there who can share messages. But if we just take that most pharmacies have between 1,000 to 5,000 followers on Facebook, with some of the larger chains having much bigger followings, and if we look at some of these chains only have a single Facebook page, so let's assume massive assumption here, there's 1,000 pharmacy Facebook pages with 2,000 followers. That's a total of 2 million followers. Each post will be seen by about 20% of your following, so that's about 400,000 views per post if every pharmacy posted, really. So if there was a daily consistent post for 30 days, that's 12 million views, and that's 12 million views on healthcare messages that can actually make a difference. And I know that's a huge approximation, but just to say that you do matter, you do have an influence, although it might be less compared to these massive social media influencers. Combined, pharmacists are much more trusted, and if everyone does their bit, there's a huge public health message you can get out there. This can then be further amplified by sharing the posts on Instagram, Twitter, LinkedIn, Snapchat, blog, your email newsletter, your local newspaper, and any other channels you can think of. And that can even be further amplified by pharmacists, technicians, OTC staff sharing the posts on their personal profiles to all their friends and family, and even further pushed by social media paid advertisements like Facebook ads, Instagram ads, Twitter ads, and even further on traditional media like radio and newspapers. So let's be clear, you have an influence, you have the community's trust, you have a responsibility to positively impact public health as much as you possibly can. So show why pharmacists can take a greater role in community healthcare, and by doing this, you will enhance the public perception of pharmacists in general. And the key to it is publishing important, reputable content about measures the general public can take to limit the spread of coronavirus and reduce the impact on our healthcare services. That's all you have to do. So think before you act. Is it reputable content? Will it help inform people how to limit the spread of the coronavirus and how to reduce the impact on our healthcare services? So 2, how to get your message seen by all of your followers and local community. So as I was saying, on any social media channel you have, these all work by algorithms and have a huge amount of variation in how many people will actually see your post. And this can be as low as 5% of your followers to up to typically around 20% of your followers will see your post. But you can kind of hack this with paid advertisements for a very low cost to reach everyone in your community. And when I say a very low cost, I mean you should reach 1,000 people for anywhere between €2 to €10. So if you're in a small town here, I'm in Mullingar, there's about 20,000, 30,000 people. So for about, between 30 to €100, I'll probably reach the vast majority of those that I want to see. And you can narrow it down even further, just trying to reach maybe people over 30. So I'm just going to go out of this presentation, quickly go into Facebook ads platform and show you how to do that very quickly. Now, there's loads of ways to optimize this if you're using Facebook ads to drive e-commerce sales and in general, but this is the bog standard basics of how to get your message out for the lowest cost and seen by everyone in your community. And if you don't have a Facebook page or Facebook ads account at the moment, it's very easy to set up. It'll take 2 minutes. There's lots of different YouTube tutorials how to do it, or just message me on the email below and I can do it for you. Yeah, so here I'll just go in and show you. So this is the ads manager profile here, and once you're all set up and ready to go, you will kind of click the create ad button and it will bring you to this first screen. And this is where you choose your marketing objective. Now there's, as you can see, there's quite a few there, and there's lots of different reasons for using different ones at different times. But as I said, you're doing the basics here. You want to reach as many people as possible in your local community, or maybe all your followers, maybe people who visited your website, that kind of thing. And the best way to do that is a reach campaign. So we choose the reach option there, and you can name your campaign whatever you want, really. Just click continue, and then you come on to this next screen, and this next screen shows you how to target people and how much you want to spend. So we'll just fly down here a bit. These custom audiences here you can use to target people who've engaged with your page before, who've visited your website and that kind of thing. But for the vast majority of people, you can go in here and just select your towns. So for example, let's say Mullingar. And you can go, let's bring it right down. So it goes down as low as 10 miles radius. Now that might be too big for some people. So just know that you can also drag this pin, and I have to zoom in a little bit. Drag this pin and just drop it on your pharmacy store, and you can then use that to bring it down to 1 mile or any distance you want, really, of a radius from your pharmacy store. And it would just be a matter of zooming in there and finding where your pharmacy store is. So once you have that done, you can then limit the ages you want people to see this. You can limit the genders. I don't think there's any need to be doing that here. And there's no need to be doing detailed targeting at the moment. This is like where you target people according to their online behaviors, their demographics, their interests, that kind of thing. But for this kind of thing, you don't really need that. And just on the right-hand side there, you can see your potential reach here. So 36,000. So you can judge your budget off that too. You can say, well, if it's going to cost me about €5 to reach 1,000 people, it's going to cost me about €150 to reach everyone here. But, that can vary a lot. Placements is important. You don't want that running on automatic placements. You want to edit this. And the main ones here I'd recommend choosing are the Facebook newsfeed, the Instagram feed. You can run it on Instagram even if you don't have an Instagram page or profile, so don't be worried about that. Once you have a Facebook page, you can run it on Instagram. Facebook Marketplace is quite a good one. And unless you have a video that you're putting up, you don't need to run it on the video feeds. I wouldn't recommend Instagram Explore. Stories, you can do that. That's quite good, but it has less room for the text that you're going to put with this post, and it's different dimensions on the pictures and restrictions around the videos. So there's a few things there. And again, these are other ones you can do, but they're not going to get a huge amount of views, and they're important for e-commerce campaigns, but for something like this, they're not really that important. And then you can come down to the budget. Now, just in terms of this step might be a little bit different if you're setting up a new ad account. This step might be at the start where we chose the reach campaign, because Facebook are always updating this stuff, and they bring in these changes periodically. So my ad account is quite an old one, so I'll be the last to get these changes probably. So yeah, just leave everything here. You can choose a daily budget, or you can say a lifetime budget, and that means you're going to say, I'm going to have a start date and an end date, and I want to spend €100 on this. So that's really good that that doesn't keep running and you forget about it and ends up costing you a fortune. Frequency cap then is also a really important bit. It's so that the same people don't see your message all the time. You're not spending money reaching the same people all the time. So you can limit how often people see it. So this means 1 impression every 7 days. This means that the most people can see your ad is 1 time in 7 days. So you might reduce that. You want people to see it once every 3 days or whatever, and then continue. And this is where the next stage then is where you actually create the ad, the piece of content that they're going to see. And if you want to save time here, you can just use one of your existing Facebook posts. So if you want to get a message out there, just post Facebook about it, and then come in here, choose existing post, and it'll give you the option to choose one of them that you've already posted to Facebook or Instagram. Now, this is where I was telling you that your Instagram account, you don't need an Instagram account. You can choose one that's associated with your brand, or you can just use your Facebook page. So this is just your Facebook page showing up on Instagram. Then if you want to create from scratch, you can choose an image or a carousel that's multiple images altogether. You enter your text here. You can add a website URL. So if you want to say you can order online, go to our website, and they can just click it. And that's basically it. You have a Facebook ad created. And so that's the target of everyone in your community. That's how you would do it. Now, if you wanted to just target your followers, you just come back to this audience setting, and you might have a broader area. So you could just choose nationally. You could choose Ireland or whatever. That would be particularly important if you're selling online. Then you come to this add a connection type, and you go people who like your page. You click that, and then add. You choose your Facebook page, and that will just target people who follow your page. So just to be aware that might, if that's the smaller the audience is, the more it's going to cost you. But again, it's not going to be astronomical. It's going to be between €5 to €20 to reach 1,000 people. That's basically it. So that's a quick run through. There's so much more. Our other marketing agency completely specializes in enhancing Facebook advertisements for business, and it's so complicated, but that's the bog standard basics to get your message out there. So finally then, I'm just going to give you an overview of how to increase your online sales if you have an e-commerce website. I suppose we don't know what's going to happen or how long this isolation period or quarantine period is going to be around. But one thing that's definitely for sure is we're going to run into a case where you're going to have less footfall in the shops, so reduced take-ins on OTC products. You're going to have less disposable income and uncertainty around people's income, whether they've lost jobs or they're not sure will they lose jobs, or it's all dependent on how long this goes. But initially, the footfall is the big problem. So, providing an online facility, if you have an e-commerce website, you may not have used it much, you may not have had any success with it, maybe it's just lying there, or maybe you do use it. But here's some actions you can take to increase your sales. If you don't want to sell online, if you don't sell online at the moment, but you want to get in touch with us, and we can help you there. Again, it takes a bit of time to get things up and running, and it's probably not too feasible that it's going to make a huge impact for you. But if you do have any queries about what that might look like, do message me. But what I would say is, and this goes for all your messaging in general, but it's 100 times more relevant now, you have to be really careful about your messaging, your offers, and your copywriting. You obviously at all times need to maintain your ethical role as a pharmacist, but there'll be much more kind of spotlight on what businesses are doing at the moment. And if you are trying to take advantage of a bad situation, so you obviously need to take action to boost your cash flow, and increasing online sales is one way to do that. But it comes back to your messaging and how you structure your offers to do that. So what we do know is more people will be online, more people will be staying at home, more people will not want to be bothering their GPs or hospitals. So people will look to pharmacies for advice and remedies to their symptoms. They're going to be shopping online more. They're going to be spending time online more. So you have more time to reach them, more opportunities to reach them, more opportunities to sell. So just think of the way your community pharmacy operates, and if there's a huge amount of footfall, you're going to make more sales. So now you have all these people on social media spending much more time on it during the day and the evenings, can't go anywhere, can't do anything. So they're consuming much more content, and that content can be your adverts, can be your content, say shop here in my pharmacy. But again, it's how you do it. So some pharmacies will be ready and experienced in e-commerce marketing and sales. To them, I'd say keep doing what you're doing, but just be careful about what way you're positioning your offers. If you're not, here's a quick breakdown of what you can do to increase your online sales. So you just to get it in your head, if you're not used to the world of online marketing, you need more people to find out that you have an online store. You need more people to visit your website. You then need more people to order from your website. And of course, the important thing is you need to do that with a profit, but you should also consider the lifetime value of a customer. So that's a big thing in online marketing, is that once you make a customer makes a purchase with you, it's been shown time and time again by any amount of research that multiple purchases become much more easier and much more frequent as they develop that relationship with you, and it costs much less to get someone to buy from you a second time. So don't just judge it on the first sale you make. Was it profitable? Really, you're judging how much will that customer spend over their lifetime and how much it costs to acquire them. So that's one way to think of it. But I would also say in times like this, where you're maybe doing this to offset some dips in cash flow, that's not the ideal thing you want to hear, but that's the reality of the situation. So these actions, some are easier than others to implement. Some you can do if you've no experience at all. Others you might need to look up some tutorials, and others you can reach out to me and ask me about, definitely. So I'd say the easiest thing you can do is publish to all your social media channels that online ordering is available, but do it in a way that says you want to help people implement public health policies to isolate more and reduce social contact. As a result, we have online ordering where you can order all this kind of stuff. So don't push it in the sense you need to make more money. Do it the way you should be doing it, and why you should be doing it as a pharmacist is from that ethical standpoint that you're trying to help people. Obviously, pharmacists have a unique dual role where you're also a business owner and you're worried about cash flow. So that's something else you have to take into consideration. But just try to remember how you're positioning your offers, or this will go really badly. Definitely email your subscribers and past customers about your online ordering facility, stuff like coronavirus updates that they need to know, pharmacy practices like you might have changed your opening hours or something like that. And just let them know that they can order online. You can run ads on Facebook, as I've shown you. Instagram, Twitter, and LinkedIn also have facilities there where you can advertise, and this can increase awareness, website traffic, and sales. I would say the first thing you can do if you're doing any of those social media advertising on any of those channels is create audience from your past website visitors, your followers, people who engage with your brand online, and your local community, because the people that are familiar with your brand or have bought from your brand before are much, 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 much more likely to buy from you again, so you can make more profitable sales. So they're the people to start with, and then you can go further. You can run Google ads for specific popular products, specific categories, and online pharmacy teams. So Google ads are when you search for something in Google, and you'll notice the first few results are pretty much always ads. So you pay Google for the pleasure of appearing there and you compete with other businesses for certain keywords. So general keywords like online pharmacy, next day delivery, something like that would be very competitive. Specific products might be less competitive, and specific categories of products may be less competitive. So have a think about that. If you're going to do Google AdWords, these can be very expensive when you don't know what you're doing. So definitely do some research about that. And I would say if you're beginning, they're probably not the first step to take. I would go with social media. It's much easier to start and less competitive initially. This is one I would really recommend, and this is for anyone, and it's so good because it takes the time pressure out of you, and it really really reduces what you have to do, and allows you to put the heavy lifting on someone else. So reach out to local and larger influencers, local companies, and anyone with a relevant following who can amplify your message. And so that could be like your doctors, it could be your dentists, it could be a physio, it could be gyms, it could be just anyone you know who has a Facebook business page locally, and maybe they're closed so they're not promoting their business, but they can help their customers out by saying, well, this pharmacy down the road have online order and prescription delivery if you need it. So reach out to them and let them know what's available there. Now it obviously other businesses are less likely to do it because they don't want to kind of appear to favor one pharmacy over another if there's multiple pharmacies in your town. But local influencers, people you've worked with in the past, people who are customers of yours, reach out to them, ask them to post about it. And the bigger the influencer is, obviously, the more you'll kind of have to pay. Some people might do this for free, particularly if they're smaller, they're only starting out and that kind of thing, or if they're a friend. But there's ways around getting the other larger influencers. There's ways around it, like giving them specific discount codes for their followers, and affiliate links. That means they get a percentage of any sale online, and you might set that up with that you give them a percentage of any sale from a discount code that happens online. I would say offer free delivery. Most places offer free delivery or offer free delivery over €50 spend. I would say straight up just offer free delivery. Take the hit. It will, the lifetime value of the customer will pay for it. Promotions of discounts. Run promotions or discounts, but do that and remember the lifetime value of the customer, but just remember how the message could be perceived, and particularly be careful with what products you're running offers on. That can be seen like you're taking advantage. Always come back to that whatever you're promoting has a real benefit and a proven benefit in whatever you're promoting it for, and just be really, really cautious about how other people might perceive the message. And to that end, I would say whatever you do online, be careful. People are going to be stressed out, pissed off, bored, looking for someone to take a shot at. And if you start appearing to be trying to take advantage of the situation, even though in your heart of hearts you're not, people will kind of cause a fuss about commenting on it, and it's all about how things are perceived. And the online world, especially Facebook, can be really kind of sensitive, and you can just have people going mad in the comments of a post if it's something that looks wrong. So the thing to do there is remember your ethics and responsibilities as a pharmacist. Thoroughly review your content and how it could be perceived by others. Don't try to take or hop on trends. So don't be like running offers on don't be running offers maybe on like high priced face masks or hand sanitizers or vitamins. Be careful what you're doing. Maybe just in general, I would say in general, just get that message out there that people can order online, that you offer free delivery, and that you're offering that as a way to reduce footfall in the pharmacy to coincide with public health advice. So your messaging should be created from the perspective of being helpful and understanding, not trying to make a profit. Be mindful of the products you're promoting. Review everything before publishing. Ask your staff, what do you think of this? If anyone has a problem with it, if you're in doubt, don't publish it. But again, if you are in doubt, if you're not sure, if you want a second opinion of someone with a pharmacist and a marketing brain, email me, screenshot me what you're going to post. I'll give you an idea about it. And just to that end, I would say if you have any questions or need help or want to bounce any ideas off a pharmacist with a marketing brain, email me there, call them at socialpharmacist.com and visit the website. As I said, if anyone needs help getting good content, public health content out on their Facebook page, key messages out, getting their ads set up for their local kind of area, we'll do that. It'll be free of charge for I suppose first come first serve on that. I don't know how many people will be able to help, but if you are struggling or if you're not sure how to use social media or you just don't have the time, you're on off your feet, I'll try and help as many people as I can, and I'll send this out to a few people, and hopefully you're seeing it. As a result of that, there might be a link. I'll try and get a page up where you can just fill in a form or something like that, but just email me. It's the quickest way. So thanks for tuning in. I hope this helps, and just kind of try and do your best, and best of luck. Thank you.